Tonight, an update on health care reform. 47 ABC has learned that bipartisan legislation is ready to be brought to the floor, but is stalling without the clear support of the president. That revelation is from Senate Majority Leader Mitch McConnell, who also said that he needs clarity about the kind of bill the president would sign. While he waits to hear from the president or have the discussion, there are members of Congress moving forward, discussing the new bipartisan proposal and talking about the other ways health care can be improved. One local senator who is doing that is Senator Tom Carper. And he was Ryan Eldridge's guest on this week's edition of Political Insider. Ryan?
Julian, thank you. Senator Tom Carper supports bipartisan legislation designed to stabilize health insurance markets by extending federal insurance payments for 2 years. But he may not get the chance to vote on it, and that's because it hasn't, as you mentioned, been brought to the floor. Regardless of whether or not it happens, the senator is committed to making changes and fixing the problems that exist with the Affordable Care Act, problems he addressed during our lengthy conversation about health care. Democrats and Republicans alike are ready to make some changes to the country's health care system, but they can't agree on what changes need to be made, or if they do, they can't agree on how to do it.
We've tried Democrats pretty much going along and in the Affordable Care Act, and although a lot of Republican amendments were included in the Affordable Care Act, we've seen the Republicans more recently try to go it alone, and I think maybe we ought to try going together.
The Affordable Care Act is under fire.
I think the Republicans for years have run on sort of like a campaign to repeal the Affordable Care Act. Repeal Obamacare.
But Republicans who ran on repeal and replace are having trouble crafting legislation that pulls their party together. A red flag for Senator Tom Carper.
The Affordable Care Act is not perfect. There's a lot of in it which I would preserve, but there are things that need to be fixed, maybe some things that need to be dropped.
When it comes to the Affordable Care Act, the Delaware Democrat isn't alone. Senators across the country, including Virginia's Tim Kaine and Maryland's Chris Van Hollen, have expressed a desire to improve it.
I think every president since Harry Truman has talked about covering everybody. And I think of it as 3 points, maybe the Holy Trinity in terms of our desires, their goals of health care coverage. Number one, quality health care coverage. Number two, affordable price. Number three, cover everybody.
Carper believes that bringing the latest proposal crafted by Republican Lamar Alexander of Tennessee and Democrat Patty Murray of Washington will be a good way to start a bipartisan dialogue. And he highlighted the efforts of a Senate committee that is tackling the challenges presented by health care legislation.
They've begun working together on what needs to be done right now, that is to stabilize the exchanges where individuals can get coverage in their individual state exchange across the country. How do we stabilize those exchanges, bring down the cost of premiums anywhere from 20 to 30%? And there's a path forward to do that. I think for the first thing we need to do is follow that path, stabilize the exchanges, bring down the cost of insurance in those exchanges, and then based off of doing that, let's work to see if we can't make progress and find common ground, Democrats and Republicans, and other ways to improve health care at a more affordable price.
It's not all about Congress either. Carper says the president still has a big role to play, at least when it comes to health care reform.
Part of it can be done administratively. The president can make clear that something called cost sharing subsidies aren't going to go away. They help bring down the cost for lower-income people in the exchanges. Make sure those aren't going away. And say we're going to enforce the individual mandate or something that's at least as effective in keeping young, healthy people in the exchanges. The idea of having a reinsurance program in the exchanges as well. Those three things would probably bring down premium costs by 35%. Some can be done administratively. Others need legislation.
Senator Carper also addressed concerns from local small businesses, saying that Congress needs to revisit rules regarding employers who have fewer than 100 people working for them. He also says that Democrats and Republicans on Capitol Hill need to consult with governors, insurance commissioners, health providers, and insurance companies before making any decisions on health care reform. Julian?
Ryan, thank you. And don't forget, you can catch more Political Insiders on our website. That's 47abc.com.